Well, here in BC, the nurses' job action continues. The union saying it's also complaining to the Labour Relations Board over allegations of employer intimidation. The BC Health Employers Association contests the union's characterization, saying they're not directing employees to perform any work outside their role, qualifications, or professional scope, or collective agreement obligations, and they are committed to directly following up on specific concerns. So that's just some of the latest in that bit of tension that we've been hearing about in the news. And then, of course, the picket lines were up around Vancouver recently. So with all this going on, let's get a perspective from the BC Conservative Labour critic, also the MLA for Prince George Mackenzie. Kiel Giddens is joining us on the line. Sir, how you doing?
I'm doing well. Thanks for having me on, both Ryan and Lisa. It's a gray, rainy morning here in Prince George, but look forward to the chat this morning.
Yeah, no, great to talk to you. We got some clouds here as well, but not the rain. So it's actually probably a good thing with all the fires to see some rain over BC. But anyways, we're talking nurses. And just before we dive into some of the specifics, what's your overall take so far on where we've gotten with this situation?
Well, it is sad that this is the first time that the nurses have gone to picket lines in actually decades for this level of job action. But it's not a surprise. The level of working conditions has been deteriorating. The government has known this. Obviously, the nurses have talked extensively about the ratios and what that means for their safety, so nurse-to-patient ratios. And the other thing they've talked about is violence in the workplace. And I think there's a breaking point that it's come to, and that's why we're seeing nurses so fed up. That's why they likely rejected the last deal, because I think the working conditions issue is something that they just can't stand.
You've suggested the BC government is showing a lack of respect for the collective bargaining process and how they've been handling this. Can you expand on what you meant when you said that?
Yeah, the government does have a role in patient safety. That is first and foremost in a hospital setting. That's absolutely true. They also have an obligation for a safe workplace for their employees as well. So they have a dual obligation in that. But what they've done is obviously we've heard from other healthcare unions that they've tried to push nurses' scope of practice work onto other unionized employees. And then there's also been these reports of intimidation. I think that has shown, a bit of lack of bad faith in the collective bargaining process. Those discussions and that work needs to be clearly discussed at the bargaining table. The nurses have filed a complaint to the Labour Relations Board on the employer intimidation issue. So I think we should take that seriously and understand that there is a process to follow here and in the legal right to strike in British Columbia.
Yeah, we've had nurses, apparently, according to the union, nurses coming forward to say they're being threatened with discipline, warned their professional licenses could be at risk, and pressured to perform some non-nursing duties and work unauthorized overtime, despite the union's job action, which is pulling the overtime. So those kind of accusations have been flying around. So it's gotten ugly. And can I just say, maybe this is weird, but the politics of this is interesting because you got the NDP in government, and they're usually, the party of Labour. And I've got you on the line. You're the BC Conservative critic. Conservatives, sometimes on the other side of that, but it's you. You got the Conservative here pointing out the working conditions and defending those, while the government is the one at odds with the nurses. It just seems like a strange moment politically to be in, too.
Yeah, absolutely. But I also think that as Conservatives, we believe in law and order. And what the NDP have allowed in our hospitals is a permissive culture that has allowed illicit drugs and even weapons into hospitals. I've heard of reports from nurses of machetes and various weapons that have been actually brought into the hospital workplace, and there are actually policies saying that we can't remove those and search patient bags or anything like that. So nurses are fed up with the lack of respect for their workplace safety, and I think that's where we certainly align in a big way. we want to have safety for all in British Columbia, including those healthcare workers who they're the first people who are with people at their first breath and their last, and I think that's something we need to have show a level of respect. My mother was a nurse as well, so I know how hard that work is and how hard they work. So it's something that we, as British Columbians, should be grateful for the service that they provide to all of us.
I'll get you to weigh in on this, too. I got a text message here at 71010 from somebody who says they are a nurse. They say, as a nurse, ratio and safety are not even my main issue. We are quite upset that news focuses on ratios as nothing has and will not change at this point. Our breaking points were reduced benefits and raises that don't follow the inflation rate. You want to talk about that angle, too? Because there's the benefits and money are certainly a big part, too.
Well, I think the benefits issue does stem very much so from the stress in the workplace. We're seeing that one nurse is going off on a leave, time loss compensation claim every 16 hours. And that shows the burnout that is happening. And I think the benefits piece of that, when you get RMT coverage and things like that, massage coverage, that's to deal with, the workplace stress at times as well, and making sure that you're staying healthy. So the fact that we're having that many workers' compensation claims in the system is really pointing to a problem, and I think that ratios are part of it. And Adrian Gear, the president of the Nurses Union, has said as much. So I do think that obviously government is in a extremely challenging fiscal situation that they've created in this province, and the fact is there's no more money because obviously the NDP have just fiscally mismanaged the province to an extent that we can't afford to pay for the public services, and that's the sad part of this today.
We're talking to Kiel Giddens, BC Conservative Labour critic. He's also the MLA for Prince George Mackenzie. Hey, thanks for weighing in on the story as we continue to follow it this week.
Thanks for having me on.